I'm sure you are all aware of the disease known as diabetes, as it is very common to find in humans, but it is also surprisingly common in dogs. It is estimated that anywhere from 1 in 100 to 1 in 500 dogs will develop diabetes somewhere in their lifetime. And although this disease can easily be managed, if left untreated for too long, it can evolve into a life-threatening condition that can claim your dog's life within hours. So make sure to watch this video, as I'll be explaining exactly what diabetes in dogs is, as well as what the clinical signs, causes, diagnosis, treatment and prevention methods are, so that you will be fully equipped to look after your diabetic dog and be able to provide him with the long and healthy life that he deserves. Hey guys, Dogtorpete here. I'm a veterinarian from South Africa. Now, diabetes mellitus is basically an endocrine disorder that can manifest as two different types. Type 1, or insulin deficiency diabetes, affects the body's ability to create enough insulin to appropriately regulate blood sugar levels, and type 2, or insulin resistance diabetes, affects the body's ability to respond to normal levels of insulin. Now, under normal circumstances, the pancreas, which is an essential organ located close to the stomach, produces a hormone known as insulin, which helps to control the blood sugar or glucose levels in the body. So when a dog eats food, its blood sugar will start to rise in relation to the amount of sugars in the food. Now the pancreas will then secrete insulin, which will trigger the liver and muscles to take up the glucose from the blood cells and to convert it to energy that they will need to perform their functions. Now, if the body cannot produce insulin, such as type 1, or becomes resistant to insulin, such as type 2, it will prevent the muscles and organs from taking up the glucose in the blood and converting it to energy. And this will result in excessive amounts of glucose circulating in the body, called hyperglycemia, whilst the muscles and organs slowly begins to starve. Now, dogs can develop both types, but they are more likely to suffer from type 1 diabetes. Now, type 1 diabetes occurs when the cells in the pancreas that create the insulin are destroyed by an autoimmune reaction, and type 2 diabetes develops when other hormones in the body prevents insulin from operating correctly. Type 1 can be found in dogs of any age, and type 2 is more frequently seen in older, obese and desexed dogs. Now, there are several possible causes for diabetes, with some breeds just having a natural predisposition for the disease, and some medical conditions such as Cushing's disease, pancreatitis, pancreatic cancer, long-term glucocorticoid therapy, and obesity may also predispose a dog to developing diabetes mellitus. Now, the body responds to high blood sugar levels in many different ways. Because of the lack of insulin, the body is unable to signal to the muscles and organs that they need to convert their glucose to energy, and thus the excess glucose in the blood will be carried out of the body into the urine instead of being used for energy, and this will result in an overall lack of energy for the dog, with a concurrent loss of weight despite a very good appetite. The glucose then ends up in the urine, which in its turn will interfere with the normal urine concentration mechanisms, and this will lead to an increase in urination, known as osmotic diuresis, which will cause the pet to become slightly dehydrated, and thus the dog will start to drink more water. Diabetes can also predispose the dog to developing systemic infections, dental disease and cataracts. Now, the symptoms of diabetes will change slightly as the disease progresses. The earliest signs that you will notice will include an increase in thirst, urination and appetite, with a concurrent loss of body weight. And then later on, you may start to notice some anorexia, which is a complete loss of appetite, lethargy, depression, vomiting, cataracts, recurrent infections, poor coat quality, and the rapid worsening of weight loss. Now, if the diabetes is not treated, it may eventually develop into a life-threatening condition known as diabetic ketoacidosis, which is a type of metabolic acidosis caused by the breakdown of fat to ketones in the liver in response to starvation. Your dog's blood sugar levels will go higher and higher, and this will cause your dog to urinate even more, which will eventually result in dehydration. Now, this combination of high blood glucose and dehydration will eventually affect the brain's ability to function normally, which may lead to depression, seizures, comas, and eventually death. Now, your vet will start off by taking a full medical history of your dog's health to try and determine when his symptoms started, how long it's been going on for, and how far it already progressed. He will then perform a thorough clinical examination and may run some blood tests and a urinalysis. Now, if there are elevated levels of glucose in the blood or urine, or even ketones in the urine, then this should be sufficient for diagnosis. But your vet may also opt to take abdominal x-rays and perform an abdominal ultrasound to look for things like kidney stones and pancreatitis. And in some cases, you may also even opt to test the thyroid levels to help gain a thorough picture of the pet's current state of health. Your vet will then typically perform blood glucose curves, which involves taking a blood sugar sample every couple of hours, starting after the morning dose of insulin and finishing as close to the evening dose as possible. This will give him an idea of what type of insulin your dog needs and at what dose he needs to get started on. The main aim of treatment will be to get your dog's blood glucose levels within a normal range. The best and most effective way to achieve this is to give insulin injections twice a day, combined with an appropriate diet and an exercise plan. Now, there are various types of insulin available, including lenti, protophane, and can insulin. And your vet will decide which one is best in your dog's specific case. Now, you will need to synchronize your dog's feeding schedule with the insulin injections and therefore have to feed half the amount of required daily food twice a day before you give the insulin injections. Your vet may also ask you to monitor the dog's glucose levels at home, either in the urine with urine dipsticks or in the blood with a glucometer, such as a Lancet device. Now, a great idea would be to keep a daily and weekly chart of your dog's diet, glucose test results, daily insulin dose, and body weight in order to keep a close eye on the pattern and to recognize when your dog deviates from its regular pattern. Now, this whole process can be quite challenging to get used to at first and may require frequent follow-up glucose checks to establish the exact dose of insulin that your dog needs. But with adequate support and attention, many owners adjust quite well to the new routine. A diet containing high protein, low carbohydrates, low fat, and high fiber is often recommended for patients with diabetes. A good option is a diabetic specific formulated diet such as Royal Canin Diabetic Care, which is available in both dry food and tins. Steer clear of supermarket pet food or tins, as it often contains a large amount of poor quality, quick digestible carbohydrates and low quality protein that will cause a rapid rise in blood glucose. Avoid dark biscuit treats or human food. Examples of acceptable treats are cooked chicken breasts without any spices or salt, or a small amount of low-fat cheese. Now, if you would like to incorporate treats into your dog's diet, stick to small treats after usual meal times and avoid snacks between meal times. Now, consistency is very important when it comes to feeding, and since the insulin dose is titrated to the diet, you will need to feed the same amount of the same food on exactly the same time every single day and avoid snacks in between meal times. If your dog is overweight, then you will need to focus on trying to get his weight under control. But this needs to be done slowly and with great care, run about over the course of 2 to 4 months. Now, if he already lost a lot of weight because of diabetes, then you will need to work on increasing his weight towards a normal range. Best will be to work with your veterinarian to establish a well thought out and strictly enforced diet plan. Now, there are some oral hypoglycemic products available that in theory should help to keep the glucose levels down, but this only really works with type 2 diabetes and is therefore not really effective in dogs. Another thing that may help is to nurture your intact female dog, as this will avoid the surge of hormones such as progesterone during the heat cycle, which can often further complicate your dog's health and contribute to insulin resistance. Now, what is really important is not to overdose on insulin, as this can result in very low levels of glucose, known as hypoglycemia, during which your dog will typically show symptoms such as weakness, collapse, muscle tremors, depression, and seizures. If your dog's appetite is down or he or she refuses to eat, then please rather consult your veterinarian and do not give insulin if he or she did not have a meal in order to avoid hypoglycemia. Now, if your dog presents with signs of either hypoglycemia or diabetes ketoacidosis, you will require immediate veterinary treatment in order to save the animal's life. Your pet will then often need to be hospitalized, put on a drip to receive intravenous fluid therapy and electrolyte supplementation, and immediately started on insulin therapy to help reduce the high levels of sugar and ketone bodies in the blood in the case of diabetic ketoacidosis, and in the case of hypoglycemia, it may need to receive intravenous dextrose to get the glucose levels back to normal. Now, preventing diabetes is not easy in the sense that most dogs have a genetic predisposition for it, but it is easy in the sense that you can prevent the conditions that will put your dog at a higher risk of developing diabetes. We now know that obesity and pancreatitis are both culprits, so make sure your dog is fed a healthy, balanced diet and that he gets plenty of exercise. Avoid overfeeding him and stay away from fatty foods. Now, I do have to mention that because of the daily injections of insulin and the lengthy process of finding the correct dosage, dealing with a dog with diabetes can often become frustrating and expensive and will thus require a pet parent to have a lot of patience. Diabetes mellitus is unfortunately not a disease that can easily be cured, but with the appropriate treatment plan and lifestyle adjustments, your dog's health can be kept stable and he may go on to live a fully enjoyable life. Just remember, it is really important to follow your veterinarian's guidelines for the dosage and timing of the insulin shots, as well as meal times, and do not stop administering the medication without prior consent of your veterinarian. Now, if your dog's appetite and body weight returns to normal and he does not drink or urinate as excessively as before, then it's often a positive sign that the disease is being well regulated. Thank you for watching this video. Let me know down in the comments if you ever had a dog that suffered from diabetes mellitus and what you and your vet did to help him. If you found the content to be helpful, I would really appreciate it if you can leave a like on this video, share it with one friend, and if you are new to my channel, consider subscribing, as I'll be posting new videos on interesting pet-related topics every week. And as always, have a lekker day, and I'll see you in another video next week. Cheers!